Our case today is a male patient, 66 years old. He was sent for us for evaluation of the biliary system and the uh, common bile duct and common hepatic duct after deployment of plastic stent in the common bile duct and the common hepatic duct in a stone impacted in the proximal part of the common hepatic duct. So we are evaluating him by abdominal ultrasound, conventional abdominal ultrasound. Of course, we see here the liver and the biliary system here. There is echogenic shadows there, and these echogenic shadows in the biliary system means that there is aerobilia, so there is good drainage. There is no intrahepatic biliary radical dilatation, but there is some sort of aerobilia in the biliary system in both liver loops. And of course, there is no intrahepatic biliary radical dilatation. And we here evaluating also the stents. So if we get the pancreas here in the middle line and with transverse section, we will find here the splenic vein and the portal vein. Here is aorta, and here is the inferior vena cava. Here is the superior mesenteric artery. Here is the head region, and by getting the head region, we can demonstrate the stent by doing some sort of clockwise rotation. We can get the stent here in the common bile duct, which is collapsed and drained beautifully by the stent. As you see here, there is some posterior shadow here, so there is most probably a stone here. Large stone is seen impacted in the proximal part of the common bile duct or at the level of the common hepatic duct, as you see here. You see, this is crescentic shaped echogenic shadow with posterior shadowing behind, so it is denoting of being a stone, a large stone. If we measure it here, we can measure here the stone. It's about 1.4 centimeters, so it's quite large. What is very interesting in this patient, actually, why I am doing this patient and I put his case, because when I do Doppler for the portal vein and the splenic vein, strangely enough, I found that there is no flow in the confluence, as you see here. In the confluence, there is no flow. Here is the splenic vein. There is no flow whatsoever, very faint flow in the confluence. And in the portal vein itself, if we trace the portal vein as you see here, by doing some sort of clockwise at the same level, there is no flow. So as there is no flow, there is portal vein thrombosis. So this case is a case report, ERCP, plastic stenting, and portal vein thrombosis. The patient actually comes to us for evaluation complaining of severe abdominal pain, and I thought that there is non-functioning stent, but actually it is properly functioning. There is good drainage. The pancreas itself, there is no some sort of pancreatitis. The pancreas itself is very good, as you see here. There is no problem in the pancreas whatsoever, but the problem is in the portal vein, which is partially thrombosed, as you see here. There is no flow here. There is flow here, but no flow there. Okay, so I start to give some sort of antithrombotic drugs. I give apixaban 2.5 milligrams twice daily. The patient improved clinically, but still the flow is not that satisfactory for me up till now. So he's on apixaban. I didn't give any heparin. So I started to give apixaban, he partially improved. As you see, by doing duplex, there is some sort of flow, weak flow. On the contrary, if we move here at the splenic vein, so there is high velocity here, but if you go there, there is very weak velocity. Okay, so this is confirming that our diagnosis of portal vein thrombosis. If I put my probe, I will put my probe here at the liver, here inside the liver, to see the portal vein, the intrahepatic portion of the portal vein again. So there is no flow. This is the hepatic artery, as you see, and there is some flow in this is hepatic artery, this arterial flow, and there is some sort of venous flow. In comparison, there is some sort of venous flow, but this is arterial flow. As you see here, this is an arterial flow. If you do some sort of change the options, you find that this is an arterial flow, very good arterial flow to compensate for the impaired portal venous flow, as you see here. So there is no flow here, but still by duplex you can detect very faint flow here, as you see. Okay, so there is very weak flow. This means that there is some sort of organization is going to happen, and we are waiting for improvement. The patient clinically improved, denoting that there is some sort of regaining of flow in the portal circulation, but still we hope that he improved completely. And as you see here, the aerobelia, the echogenic shadows here, the brightness here, and the echogenic shadows, glistening echogenic shadows denoting air inside the biliary system. So he has very good drainage, but there is portal vein thrombosis. So we need some sort of explanation if there is any abnormality in the vasculature in this patient because of the contrast, for example, that diffuse extravasate or passes to the circulation doing such chemical thrombosis or so. So still it is a matter of debate, and we have to discuss this case, and it could be a case report for us to discuss it in different places, in different scientific meetings and so on. So as you see, again, portal vein, very weak flow, as you see, very weak flow, and this is the hepatic artery, and here there is very weak flow. On the contrary, in the proximal part, there is good venous flow. Okay, so this is very impressive, and I will update you by this case. Thank you. شكرا يا حاج، تعبتك معايا؟ معلش حبيبي. السلام عليكم. اتفضل.